All right, let's jump right into it. If you've been pregnant or know someone who has, that glucose test is probably pretty familiar. But did you know there are actually two totally different ways to do it? So today we're going to break down the one-step versus the two-step approach for diagnosing gestational diabetes and get really clear on what each one is all about.
You know, it's just a standard part of prenatal care, but the path your doctor takes can look very different depending on the method they use. One way is a single, pretty intensive test. The other starts with a much simpler screen and, might lead to a longer follow-up. We're going to explain exactly what that means.
So here's what we're going to cover. We'll start with why the screening happens in the first place. Then we'll get into the two main ways to diagnose it, the one-step and the two-step methods. And finally, we'll pull it all together so you can really understand the results. Let's get to it.
Okay, first things first. For pregnant women who don't already have diabetes, this test is just a routine checkup. It usually happens somewhere between 24 and 28 weeks, and it's all about checking for a very specific condition that can pop up during pregnancy.
And that condition is Gestational Diabetes Mellitus, or GDM for short. Put simply, it's a type of diabetes that gets diagnosed for the very first time while someone is pregnant. It changes how your body uses sugar, and it can affect both the mom and the baby, which is exactly why this screening is so important.
So, how do doctors actually test for GDM? Well, this is where it starts to get pretty interesting. There isn't just one single universal way to do it. Instead, there are two main strategies that are recommended and used all the time. And we're not talking about some random methods here. Both of these approaches are officially endorsed by major groups like the American Diabetes Association and the American College of Obstetricians and Gynecology. It really gives doctors a choice, and that choice often boils down to a trade-off. One method might be a bit easier for the patient, while the other might be more sensitive and end up diagnosing more cases.
Let's dig into the first option, the one-step method. Just like the name suggests, this thing is designed to be an all-in-one test. The idea is you go in once, you do the test, and you walk out with a clear answer.
So here's how it plays out. First, you have to fast overnight, no food. When you get to the lab, they'll take a blood sample to get your fasting level. Then, you drink a very sweet liquid that has 75 grams of glucose in it. After that, you'll have your blood drawn 2 more times, once after an hour and then again after 2 hours. Now, this is the really critical part of the one-step method. To get a diagnosis, you only need one of those 3 blood test results, your fasting, your 1 hour, or your 2 hour, to be at or above a specific number. Just one. That's it.
And here are those magic numbers. For your fasting level, the cutoff is 92. For the 1 hour test, it's 180. And for the 2 hour, it's 153. So remember, if even one of your results hits or goes over any of these numbers, that's a diagnosis.
All right, let's switch gears and look at the second approach, the two-step method. This one works differently. It starts with a really simple screening test, and you only move on to the full, longer test if that first screen shows a high result.
The first step is actually much simpler. And the big plus? You don't have to fast for this one. You just drink a 50-gram glucose drink, which is less sugar than the one-step test, and then you get your blood drawn just one time, an hour later. For a lot of people, this is the only test they end up needing.
So the whole thing hinges on this number right here, 140. If your 1 hour result is 140 or higher, it does not mean you have gestational diabetes. It just means you need to come back for that second, more definitive test. If your number's below 140, you're in the clear.
For anyone who does need to go on to step 2, well, this part is definitely more involved. You do have to fast overnight for this one. Then you drink an even more concentrated 100-gram glucose solution, and your blood gets drawn a total of 4 times, once for a fasting level, and then again at 1, 2, and 3 hours after the drink.
And here is the other huge difference from the one-step method. To get a diagnosis with this approach, you need at least 2 of your 4 blood test results to be at or above the cutoff values. Not just 1, 2 or more.
Now, when you look at the cutoffs for this big test, you'll see a couple of different sets of numbers. For fasting, it might be 95 or 105. This just depends on the specific guidelines your doctor's office follows. But no matter which set of numbers they use, the rule is exactly the same. 2 or more of your results have to be high for a diagnosis.
Okay, so we've looked at each method on its own. Now let's really put them head to head. I think seeing them side by side makes the differences crystal clear. Let's break this down. For fasting, the one-step requires it from the very beginning. The two-step, only if you have to do that second test. The amount of glucose you drink is different. The number of times you get your blood drawn can be wildly different. 3 times for the 1-step, but either 1 or 5 for the 2-step. And, most importantly, the rule for diagnosis is completely different. 1 high reading versus 2 high readings.
So what's the bottom line here? The 1-step method is basically one and done, but it's a longer appointment right from the start. The 2-step method is easier to begin with, but it can turn into a much longer process. At the end of the day, the choice between them comes down to your doctor or your health system, and it really is a balancing act between patient convenience and how the test is designed.
And that leaves us with a final thought, doesn't it? We have 2 different officially recommended ways to identify the exact same condition, and the decision is left up to doctors and health systems. So what does having these 2 different paths really mean for consistency in patient care and how many people get diagnosed? It's definitely something to think about and maybe even talk about with your provider.